My name is Dr. Edwin. I'm a director of Edwin Lim Medical Aesthetic Clinic, and in the last 2 years since COVID started, I have seen an uptick or surge in number of acne cases, primarily I think due to wearing of the mask and also for more people working from home. When they work from home, when it's more humid, they don't turn on the aircon, or they just slack off a little bit the skincare regime. I often get asked, what is the very best treatment for acne? Is there a miracle bullet that can cure acne straight away? The unfortunate answer is not that simple. Everyone's skin is different, so we must customize and tailor the approach to your skin type and your type of acne. When we treat acne, I would broadly classify the treatments into 4 different categories. So the first one will be things like skincare. The second will be oral medications. Third will be treatments like lasers, facials. Lastly, we can do pimple injections or the so-called famous cortisone shots. So how I decide which treatment to use will depend on the severity of acne. For example, if a patient presents with just blocked pores, small little pimples, we can start with skincare first. But if someone presents with more severe acne, like big cystic acne, then we may need a bit more help. We will combine skincare with oral medications like antibiotics. For those who are a bit more pressed for time, like if a big event to attend or if a wedding that's coming up, we can add in treatments like lasers, like the pro-yellow laser, or things like a medical facial, as well as lastly an injection. The injection contains antibiotics and anti-inflammatories. We call it the SOS injection. When we inject into the pimple, it does help the pimple recover more quickly. So in our clinic, we have a specially formulated skincare line to target acne. So it has different functions such as exfoliation. Blocked pores tend to lead to acne, and therefore the most important part first is to unblock the pores. Next, there will be ingredients to reduce sebum. Less oil equals less blocked pores too. And then something that focuses on bacteria killing to help prevent new acne. Lastly, there's always a spot cream that helps to target the big pimples. We always recommend something with antibiotics and anti-inflammatories. Once acne is more stable, the next step in treatment will then be focused on repairing the skin and to help to basically eliminate or reduce the damage that acne is left behind. Things like your red marks, brown marks, as well as depressed scars. You have your skincare lasers like the yellow laser. For brown marks, you have lightening creams as well as the pigment lasers that can lighten these blemishes. You have different type of acne scar treatment options like the resurfacing lasers, as well as rejuvenant scar and subcision injection treatments. In this case, we can start with skincare as well as treatments like the lasers and facials first. But depending on the severity of acne, some patients may need the oral medications. If not, progress may be slower and the results or improvement may be less significant. In the first 3 to 4 months, I'm going to aim for 30 to 50% improvement. After 6 to 8 months, my target for them is 80 to 90% improvement. Everyone's skin is different. If you want to find out what's the best acne treatment option for you, do consult with a medical professional.